Health. It's a big subject. Let's try talking about health without mentioning healthcare at all. While the health of many Australians has generally been improving, the health of Tasmanian people is among the worst in the nation. And we know what causes this. More than half of us are overweight or obese. We drink and smoke too much. We don't eat enough fruit and vegetables. And we don't exercise enough. Being unhealthy comes at a very high cost to each of us and to our families and the community as a whole. Social research has taught us that people on lower incomes have worse health than those on higher incomes. It seems the wealthier we are, the healthier we are. But why? Don't all Tasmanians have access to the same health services, the same education? Don't we all have the freedom to shop for good food and to choose what we do for entertainment? It's just not that simple. Our health improves with every rung we take up the social and income ladder. Our lives are partly shaped by our level of education. It affects the sort of jobs we can do and the way we connect with our local community. Education gives us the knowledge to help make healthy choices. It also improves our confidence with others and our ability to access services which might help us change and improve our lifestyle. As Tasmanians, our lives are shaped partly by government, which develops policies on health support services, affordable housing, employment and social equality. Within our local community, our lives are shaped partly by each other. Tamika is a 22-year-old born and raised Tasmanian living in a rental house in the outer suburbs. She's at the health centre again today. Her asthma is getting worse. The cigarettes aren't helping. So why does she smoke? Tamika says it helps her feel less stressed about her cold, damp house, especially when the neighbours have been shouting abuse over the fence at her again. The landlord says she's lucky to have a place at all. So why doesn't she move? Tamika works at a local takeaway. She's a casual employee and she's never really sure how much she'll earn from week to week. So why doesn't she get a new job? Tamika finished school in grade 10. She doesn't have the qualifications to get a better job, and the courses she would like to do are far too expensive. There doesn't seem like much reason not to smoke. Some of the choices we make are shaped by the choices we have. So what does Tamika need to improve her health and well-being? She needs help to create a healthier lifestyle for herself, help to develop better living skills, to be able to find better housing. She needs advice on finding affordable education that suits her learning needs. She needs to be a part of a diverse, safe and open community to gain confidence in herself and make more informed choices. She needs reliable employment, a strong local economy and a government with good social equity policies. For Tamika and for all Tasmanians, there needs to be change for the better. We need to change the way we think and the way we live. More beds in hospitals or more health professionals won't improve our community's overall health and well-being. If we continue the way we are headed, the cost to Tasmania's health budget will spiral upwards to unmanageable levels. Consider this question: who could change and improve the lives of all Tasmanians? The answer is clear: we can. And how? By shifting our own attention to our community's productivity and prosperity, and in turn, our community's health and well-being. It's about making sure we have access to a good education, access to transport and opportunities for employment. It's about friends, families, workmates and peers. It's about affordable homes, locally grown produce and sustainable industry. It's about the place we call home, our community. It's about community connectedness and community support. Tasmanians are resilient, creative and hardworking. We're known for finding inspired solutions to complex problems and for supporting each other through times of trial. We can improve our health as Tasmanians because we are nurses, teachers, administrators, builders, artists, mums and dads, students, local councillors. We are the Tasmanian community, and together we can rewrite Tamika's story. So let's start a conversation with each other about health and not talk about health services at all. Together, let's find a way to move towards a positive future for all Tasmanians.